Good evening, everyone. We are thrilled to welcome you to our very first Instagram live session from Dr. Michael's Instagram account. I am Dr. Amir Hadjhamou, a specialist prosthodontist, and this is my colleague, Dr. Mauricio.
Hi guys, how are you doing? Good evening. I'm Dr. Mauricio. I'm here, implantologist and periodontist here in Dr. Michael's. And we are here to answer you guys about all questions that you may have regarding implants, regarding veneers, and whatever you guys have to ask.
And many more topics. I think we'll keep it open to the audience and whoever's following us to shoot at us as many questions as you want. As a matter of fact, we already prepared a few topics to talk about, right?
Yeah.
I mean, it's a fact. A lot of patients nowadays come over wanting to get veneers. It's the number one thing requested by patients. But what patients don't seem to understand is the relation of what we call pink with white. What do you think, Mauricio, from your point of view?
Yeah, there is a big tendency, right, that the patients have a tendency to see basically teeth as the white perspective of the treatments, but it's fundamental, the pink aesthetics, for what we call a proper full treatment and to get the best outcome of treatments, of the results for the patient. The pink relation is much more, it's as important as the white part.
Indeed. And it's one of the first things I tell my patients usually when they come for smile makeovers. I insist on one specific point, is you can't get veneers done if the soft tissues or the gums or the gingiva is not healthy. So
Yeah.
the first line of action is to address that with a hygienist. In severe cases, I will refer them to you, obviously.
Yeah, exactly. Hygiene is for sure the most important things for maintenance of almost any treatment that we have. In case of veneers specifically, well, when we're starting the case from day one, it's much easier to approach when the patient doesn't have veneers yet, which is to approach properly as a preconditioning of checking the patient how to clean once they have the veneers, to have healthy gums, to see if there's no periodontal disease. It's a much easier, let's say, the remaining part of the treatment with Dr. Amir is much easier. But unfortunately, of course, we have several cases that we have to address patients that problem is already installed, or veneers were done, not exactly in the best performance, and then that means that in several cases, especially, it's a gum problem related. The veneers, several cases, veneers actually looks fine, but gums not necessarily. And then you have to address everything, which is always a little bit more complicated to treat. When you have, let's say, to fix a problem, then starting from let's say, from native tissues and native teeth.
Absolutely, agreed. So it's one of the first things we emphasize on is how to manage the pink around the white to get harmony, and it's one of the things that patients tend to neglect and ignore, whether it's before the treatment or after the treatment, because once the patient's got veneers done, they have to understand that they have to be maintained healthy, just like they have to maintain their natural hair.
Yeah, for sure.
And this is where the struggle begins, because of course there are certain scenarios and situations where if the work has not been properly done, if the veneers were a little bit over contoured, resulting into a small bulk area, the level of the gingiva, then it can be challenging for the patient to maintain the skin. So this is where the prosthodontist or the restorative dentist who will be restoring the patient's smile has to have a certain degree of expertise in the field.
Yeah.
To just emphasize to our audience, I am a specialist prosthodontist, so the specialty of prosthodontics deals mainly with crowns, veneers, smile makeovers, implant restorations. So if you have questions in regards to these few topics, I will be the one answering them. While Dr. Mauricio here is a specialist periodontist, and periodontics is?
Well, basically it's treatment on the gums, right? We have the whole approach regarding soft tissues, also treatment of the bone, pretty much what's not teeth.
Exactly.
So basically treatment of the bone, treatment of the gums, also work as a specialist in the implantology, so the surgical steps on it pretty much, is my side of the treatment here.
Did you say implantology? So that's the second hot topic that most of you probably would want to have a lot of questions to shoot and ask. Basically, implants, dental implants. There's so much to talk about, right, Mauricio?
Yeah, a lot
We'll be
for
on
sure.
and on for hours. So I don't know if we've prepared a few questions that we could be sharing with the audience by the time they start shooting their own questions. What do you think?
Yeah, sure, of course.
So, you want to take the first one? Go
Yeah,
ahead.
so basically what we have is regarding if a patient asking, do I really need to replace my missing tooth? And what would happen if I didn't? Well, basically, of course, ideally, with basically the exception of being a wisdom tooth, I would say, ideally you have to replace the missing teeth for the whole sake of the stability of the bite. The main issue is that on the long term is not something needed, of course, even because in several cases you have to do the implants and there is a healing time that you have to be waiting for the bone to heal completely. But on the long term, a missing tooth may lead to several bite-related issues, such as probably the tooth that is located more in the posterior side of the extraction area. The teeth has a tendency to tilt. Normally the antagonist teeth, which is the opposite one in the opposite arch, has a tendency to erupt and then basically start having several issues regarding the bite. The patient with time start collapsing the bite. The bite's not going to be as comfortable as used to be. Patient probably is going to have a tendency to start biting much more in one side than the other, which may lead to some joint pain. So yeah, recessions around. When you remove the tooth also and you don't replace it, the longer that you wait, you start losing bone. The bone starts absorbing. And sometimes you have patients that want to do implants and they lost the tooth many years before, like 10, 15, 20 years before. In those cases, it's very common that when we double check the bone condition, there is no bone anymore. So we have to go for grafts or something like that. And when we have a much more, let's say, immediate approach, and pretty much evaluate this on time, this can be avoided. Basically, it's going to be a much easier and a much straightforward approach on treatments.
Correct, and I'd like to add, if you allow me, that dental implants are not always the only way to replace missing teeth.
Yeah, of course.
So there are also dental bridges that have existed for years, except that if you are to replace a missing tooth, you agree with me, Mauricio, the best way to replace it is through an implant, because a bridge will consist of shaving down the tooth before and the tooth after in order to replace the missing tooth that will come hanging in between the teeth, the two teeth. So you end up being more invasive, and you end up shaving down teeth that do not necessarily need to be shaved down, that could be healthy. So obviously implants would remain the best optimal way
Yeah,
of replacing missing tooth.
and I would add also that it's very common that patient, by the fact that the patient has in their minds that it's a surgical step, it's very common that they overreact about being a surgery. But it's important to mention that implant surgical procedures, especially when we're working on a good ridge, on a good bone, if everything's fine, healing, the bone is good, no infection, gums are fine. If you're working in ideal conditions, the implant procedure, from the patient's tolerance, let's put it this way, it's extremely easy. It's a procedure that it's normally quick, predictable. Normally, the way that I usually explain to the patients is extraction sometimes has a harder healing than the implants per se. So there is a lot of, let's say, patients several times they are very skeptical about, I have to do a surgery, I would like to avoid this.
True.
And it's a much easier process and much better than the fact that you have to end up involving two other teeth that, to begin with, if you do an implant, you don't even have to touch it. You can pretty much preserve. And ideally, that's besides being a surgical procedure, and ends up being less invasive overall on the long run.
I mean, don't get me wrong. I mean, I've seen you placing implants in ridges where there was no bone, and you still managed to graft the area.
Yeah, exactly.
You've done a great job. I mean, I've witnessed this myself. If I were to get an implant, I'll probably come to you. You'll be the first one I come to. So, more questions? I mean, I'm going through the questions that have been asked. So now we switch back to veneers, or shall we go on? Yeah, let's take this question. So the question is, what should I ask my prosthodontist before getting veneers? As a matter of fact, I'd like to rephrase the question, and probably the question we should be asking is, what should I tell my prosthodontist before getting veneers? Because I've always said, when you get veneers, veneers is an elective procedure. It's a procedure that a patient could do or not do. It's not treating, it's actually improving a patient's smile. And when we do veneers, I mean, a lot of patients, a lot of dentists, unfortunately, think of veneers as being a set of 10 upper, 8 lower, where it could be less than that, it could be 4, it could be 6. And it actually depends on what the patient expects, you know, and it's our job as dentists, as our prosthodontists, to be able to kind of like understand what the patient wants and expects from their smile and give them options. One of the first things I ask my patient to is basically, what is it that you don't like about your teeth? You know, for example, the patient that comes over and tells you I want whiter teeth, then probably the first line of action could be just getting them a bleaching done.
Yeah, exactly.
You know, because less is more, you know. But then if a patient wants to change the shape, the size, and close down spaces, and get a whiter, healthier smile, then obviously veneers would be an option. So I've always said the patient's expectations will dictate what and how big the treatment would be. So it's very important when you go for a smile makeover consultation to have a pre-made list of questions you ask your prosthodontist in order for him to be able to help you get the smile you've always dreamed of. What do you think about that?
Yeah, completely agree about it. The most important thing is attending patients. I think the expectancy of the patient is one of the most important things, which is kind of not dental related. To understand what they want to achieve, what is possible to be achieved, what is required. So for sure this is, and sometimes that's not the easiest.
So we got a live question here, Mauricio. This one is for you. Let me shoot it at you. So one of our followers is asking if our implant folds, can we replace it with a new one?
Well, yeah. Well, first of all, we have to understand what happened, because it's important to emphasize that the rate of success of implants is very high. So a situation where you have a failure of implants, of course it's possible, but nowadays is a range of, the rate of success is a range of 98% or something like that. But let's say if the patient unfortunately loses the implant, the implant fails, and if it's possible to do a new one, well, let's say a fast answer will be yes, it's possible. But first thing, we have to explore why the patient lost the implant. So pretty much we don't repeat the same problem. So if there is an issue of an infection or something like that, basically the implant wants removed, you clean up the area. Sometimes it's going to be required to do a bone graft, but basically ideally you approach the problem first, the cause of the implant lost, first of all. And once the area is established in a healthy situation again, you can replace an implant without an issue.
So we got another question being asked by one of our followers. The question goes as, I'm going to get veneers soon. Should I choose porcelain or composite? It's actually a very common question.
Yeah.
And I mean, I've worked with both. I've worked with composite veneers a long time back when I first started practicing dentistry, and I know that it remains a more affordable option.
Yeah.
But composite has got its pitfalls, and what we can achieve in terms of cosmetic or aesthetic outcome with ceramic veneers is not comparable to that with composite. So the problem with composite is with time, they kind of get discolored.
Yeah.
So they get discolored.
They don't last as long.
They don't last as long. And we've witnessed a new generation of composite materials in the markets that have proven that to be, you know, quite very attractive in terms of the aesthetic and optical properties it has, but in return, over time, it cannot compete with ceramics. So definitely my answer, if anyone can afford, of course, to get porcelain veneers, the first number one option is to go for porcelain veneers. and then we could eventually later on elaborate on the type of ceramics available and how these smile makeovers work on the long run.
Yeah.
You got another question for
I
you?
have another question now regarding how long do implants last?
I get that a lot.
Yeah, also, yeah, true. So, well, basically, I normally explain this in two ways. Because first of all, what people, most of what I have to explain to the patients is by the terminology implants. So number one I explain is implants are always are divided in two steps basically. You have the implant per se, which is the surgical part, and you have the crowns. What I can explain is like this: implants, surgically speaking, the let's say the screw that is installed, the implant per se, yes, they're meant to last as long as possible. We don't do implants expecting that they're going to fail down the road 20, 30, 40 years. And nowadays we have studies supporting, we have studies long enough supporting that implant stability can achieve a lifetime. So this is when we do implants, that's what we expect from a surgical perspective. So yes, they're meant to last long, pretty much, yeah, as much as possible.
But then there's, I mean,
What is the conditions, of course? Hygiene. So the way that explains like this, the same way that a patient, due to, for example, lack of proper cleaning, lack of flossing, the patient can start having gum inflammation, this bacteria reaches the bone and starts losing bone around the tooth that eventually lose the tooth. This can happen exactly the same way around an implant. So if the patient is able to maintain periodontal health, implants can stay as long as possible. Considering, honestly speaking, considering that we have patients doing implants, let's say, on their 50s, 40s, yeah, it can last the remaining part of their lives. Prosthetically, then, although it's prosthetically is eventually have to change the crown due to wear and tear, right? So this part is more.
yeah, I mean, I'd say pretty much like your natural teeth.
Yeah.
Implants could fail for the same reasons your natural teeth will fail. You know, if you're not able to maintain proper hygiene, then definitely. In terms of the prosthetic crown that comes on top of the implant, so that's what we place on top of the implant, right? Just to explain for those who are not familiar with what implants are about. So it's a screw that you put in the bone, and then on top of the screw there is a small pillar on top of which the crown sits. So usually crowns would survive, you know, quite long, but you'd expect some chipping sometimes over time, some wearing of the ceramics, especially if the patient, for example, develops what we call parafunctional habits, or more specifically becomes a grinder.
Yeah.
So just like they could wear off their natural teeth, they could wear off the crown. So you expect the crown to be changed within 15 to 20 years in certain scenarios or certain cases. But again, I mean, I don't know about what you think, Mauricio. We never had a chance to speak about this. I don't believe we should give a time frame to any treatment because it's quite difficult. It will depend on the patient and whether that patient is compliant with whatever instructions the dentist, the implantologist, the prosthodontist has given them. So it's very difficult to say, oh, it will last this number of years. You'd expect it to last as long as possible based on, as you said, literature and research and everything. But again, it will depend also on the patient. You know what I tell my patients, Mauricio? Every time I do a smile makeover case, I tell my patients I've done 70% of the work. The next 30% are on you. You know, I can't be home with you making sure that you floss, you brush your teeth, you put your night guard on before you go to bed. So I make sure that my patients are as responsible as I am for the long-term success of the veneers, and that's very important to emphasize. We've got another question. This one must have been asked by a dentist for sure because it's very technical. Are you supporting vertical veneers preparation instead of horizontal? That's a very technical question, but I will answer it shortly and briefly. Definitely horizontal preparation. Having a finish line preserves the over-contouring of the cervical margin, and you don't want to end up inducing periodontal problems on the long run. This is what I was saying earlier, when the veneers come on top of the gums and there is not enough space accommodated for that veneer, then you end up having difficulties brushing and cleaning, and it becomes more challenging.
And the main problem on those cases like that you just mentioned is the fact that these problems, especially gum problems related to veneers, they don't show right away.
Yeah.
So they happen down the road. So it's a problem that maybe the gums bleed a little bit, but there's no pain for sure at the beginning, and then the patient start having swelling, and then let's say the gum really gets worse. Many months later, sometimes even after a few years, that the patient realizes like, my gums, they never solved it, and that was an issue on the first design of the veneers or the prep or even the cementation sometimes.
Absolutely.
So.
Oh yeah, this is a very important point. A lot of patients having veneers, they come back to us a few years later, and the concern is basically, oh, I've got gums bleeding and I've got a bad smell.
Yeah.
And that's a very common thing that we get from patients who've had veneers previously in somewhere else, you know. And this is one of the things that we dentists should a little bit educate our patient about. Basically, is of course the importance of hygiene, but us as dentists, we need to guarantee that we're able to remove all the excess cements that are used to stick those veneers. So sometimes one of the most, or the number one reason for these complications is basically an incomplete or a job that was not done properly by the dentist. And in a lot of cases, we have no choice but to take everything off and start from scratch. And it's always much more complicated to start from scratch. That's why I always tell my patients, if you can't afford to get proper veneers, don't get them done in the first place. Rather than going for, you know, something a little bit more affordable, but maybe not the best for you.
Sure.
So another question for you, Mauricio?
Well, the question is, what can I eat after an implant surgery? Well, there's again, I think it's a very standard protocol nowadays regarding after surgeries, dental surgeries in general. There is a few restrictions, nothing massive, but basically to make this, let's say, it's a more general question as we are here on live, and we're kind of getting as general information. Basically, the real begin, let's say, right immediately after the procedure, I always recommend the patient to go to a more liquid, cold diet. Anything hot is going to stimulate bleeding, pretty much. And liquid, so you don't have anything to chew that may affect the surgical area. So it's more like smoothies, vitamins, ice cream, as everybody knows, afterwards. So it's more like this on a more immediate follow-up after the surgery. And then basically patient goes more to a soft diet, more room temperature, and then normally patient escalates. So basically as the day goes by, the healing improving, the patient can go more to his regular diet as increasing temperature consistency inside a comfortable zone, maintain the area clean, which is most important. So I would say that's the most general way of doing it.
Cool, we got a question for me this time. What are the criteria for veneers without reducing teeth? So they've got different ways of calling them, you know. So it's veneers without having to shave teeth. The scientific term for it, as you just said,
non-prep, as they say,
is non-prep veneers. Non-prep veneers. Now some people would call it lumineers or whatever you want to call it, but this is more like a trade name or a trade brand. So I'll be honest with you. I mean, non-prep veneers are highly demanded by a lot of patients. But to be honest, a very small number of patients can receive these kind of restorations. I do them, but it's like probably 2-3% of my patients.
It's not a matter of choice, it's a matter of clinical condition.
Absolutely. It depends on the case itself, whether or not it's indicated for veneers, non-prep veneers, conventional veneers. It will depend on the situation for which the teeth are being veneered. So let's say, for example, the tooth is rotated or slightly proclined. You can't do a non-prep veneer. You've got to shave the tooth, absolutely, because it's going to be more bulkier. So this is what patients have to understand. It's a case-by-case scenario. There are certain situations where we can offer our patients non-prep veneers, but what I practice, and you know it more than anyone else, is what we call minimally invasive veneers. So even when we shave down the teeth, we don't shave down much of the tooth structure. So basically, to put numbers on how much reduction we do, we're looking at 0.3 to 0.5 millimeter reduction on an average on each tooth, which is almost minimal. I could eventually go as far as not shaving down the tooth, not anesthetizing the patient, while I'm doing the procedure because it's pain-free.
Yeah.
So yes, we are looking at that. If the teeth are very much malaligned, then in this case, we should place veneers in the first place. We should go for orthodontic treatment first.
Yeah.
Get the teeth aligned with aligners, Invisalign, or conventional orthodontic treatment, and then come back to the prosthodontist to get your veneers on a properly aligned set of teeth, which would require almost minimal shaving of the teeth structure.
Also something that I see, although I'm not the prosthodontist that does a lot of these procedures, but it's interesting that sometimes patients, they see this is a very black and white situation, which means or is everything on prep or is everything prep.
Yeah.
And sometimes you may have a tooth that is a little bit more inclined inside that this one I can not prep it.
No, but for an
And
implantologist,
see?
you keep surprising me, Mauricio. Indeed, yes, it's actually a very.
And then some you may prepare, others don't. So,
Absolutely.
So,
So each, I lecture about veneers, and I've always said to the students or the doctors that attend my courses, usually when you do veneers, my makeovers with veneers, each tooth is a patient. Each tooth has a different scenario from the one next to it. So as you mentioned now, it's a very good point you made. As you mentioned, a tooth could be shaved down minimally. Tooth could be shaved down a little bit more than
it's
the
not
other.
like all of them are going to be shaved the same way.
And
or
it's more
shaved at all.
challenging for the dentist, but if the dentist is good and can manage to get the exact same shape, size, color of the teeth, and so be it. That's why it's really important to make sure that if you get smile makeovers, you go to the right person.
So I have another question. Basically, was asked if currently I wear partial dentures, can I replace them with implants? Well, that's exactly the idea. So what I have to say first is, of course, it requires an evaluation. As I always explain to my patients, implants, they have one main requirement, which is bone, so we can do it. And another thing that I usually commonly say is like, nowadays there's pretty much no clinical scenario that implants are not possible. The question is what is required for the implants to be done. So, of course, with a proper evaluation, that basically for implants mainly, it's a clinical evaluation plus ideally a CBCT, so we can have a proper image of the bone. We can see if the patient is already a candidate for implants right away. But basically, that's exactly the idea. If the patient is wearing a partial denture, removable one, and of course, putting back and forth, ideally, this is the main candidate for implants in order so he can have permanent ones.
I'm going to add to that one, which is going to bring us to a whole new topic. How about patients with complete dentures?
Yeah, that's another one.
So that's pretty much what Mauricio and I have been doing for the last few years, which is the all-on-4, all-on-6 concept, where we re-established the patient's rehab. It's a full mouth rehab. We established the patient's function, aesthetics, everything is re-established by placing implants and placing a prosthetically or a prosthesis on top of the implants. And this is what we've been doing, where we can, Dr. Mauricio, being the implant surgeon, we have the clinic, we'll put the implants or the screws inside the bone, and simultaneously after placing the implants, I'll step in and I'll put a fixed prosthesis. So the patient comes out in one day. He comes in with no teeth, comes out with fixed prosthesis for the next couple of months, and then 2 months later they come back.
The permanent one,
and then we get the permanent ones done.
Yeah, this is probably the most, with modern dentistry, I'll believe that this is the most life-changing procedures we can have in dentistry, because it's a change not only on aesthetics, quality of life, to the patient be able to chew again. Of course, veneers is all nice, but it has a cosmetic point of view. When you're literally giving back a mouth to the patient, that for quality of eating, self-esteem.
Yeah.
So it's really impressive what this procedure can do, not only dental but for the patient's psyche.
So I just got another question. It says, how many implants do we need to restore a full jaw that has no teeth? A patient who comes with a denture on the upper. How many implants do we need to restore that?
Well, basically I would say that there's a variation, but basically we're saying that normally it's something you can pretty much achieve with something between In the lower jaw, it's pretty much normally 4, between 4 to 6, I would say. But normally 4, we can achieve the results that we want. In the upper, normally it's in theory you could do 4, but ideally it's 6 to 8. So basically, I would say the most common is 4 and 6. So basically, with 10 implants, you're pretty much restoring
Full mouth.
20 teeth. Yeah.
So not every tooth.
Yeah,
needs to
exactly.
be replaced
Support
with an
setting.
implant. So a lot of people think we have 28 teeth or 32 teeth with the wisdom teeth, and if
And they have to put
and they have
28
to put
implants.
28, and they're like, no, I can't do that. So no, it's only 4 to 6 or maybe 8 tops, and then you can restore a full arch.
Yeah.
Great. I got another question. Oh, this takes us back to the point we spoke about earlier, which is how long do veneers last normally? So again, don't like to give numbers on how long the treatment will last, just because we can't predict the future. This is a human body we're dealing with. So and there are certain habits the patient might develop over time that we as healthcare professionals have no control over. So it's very difficult to give a certain number of years, but I would expect, based on my personal experience. I mean, one of my first patients getting veneers, you know who it was? My mother. Got her 6
Poor
veneers. Got her 6 veneers done 16 years ago.
All right.
And trust me, it's a patient I follow up quite often, since she lives here in Dubai, so I have the privilege.
It's good. I believe you can be quite honest with her if something goes wrong.
Exactly. I'm like, oh mom, sorry, I didn't do it right. But no, things have been stable. But does it mean that every veneer I make is going to last 16 years? No, that's not a general rule.
Of course.
We'd expect veneers to last somewhere between 15 to 20 years. As you said earlier for implants, I said the same thing for veneers. That's what we target. But then again, there are certain parameters and certain factors that could bring that lifetime expectancy to much lower rates, depending on the patient's compliance, depending on the hygiene and all the different points we mentioned earlier. So, more questions?
Yeah, we have one here that there's a little compliment regarding the question we had before, which is
regarding implants, yeah.
Yeah,
right.
what is the minimum number of implants that can be used to restore fully edentulous patient with severe bone resorption?
This is a question that must have been asked by a dentist. No, what do you think?
Yeah, possibly, yeah.
It looks a bit technical.
Yeah. Or at least a patient that just received a diagnosis is reading.
Yeah, true, that too.
But anyway, basically, it doesn't change much from the answer we gave just a while ago, which is, I would say the ideal number and the most common that we use is 4 implants lower, 6 upper. But the fact, even if the patient has a severe bone absorption, but what changes then in approaches like that is very likely this patient is going to require grafts before. So the number of implants probably is not going to change. We may go very technical here because there are other alternatives you go back again, but then we're going too far. But basically, I would say that in case that the patient has severe bone absorption, we have to deal with the absorption first. We have to have good bone in order to put the implants. Certain cases you can do the graft at the same time as the implant. Again, we're going too technical here, don't want to go there. But basically, the amount of implants ideally is not going to change. It's just that probably a patient with severe bone resorption is going to require some bone grafters procedures previously, according to whatever needs to be approached.
Absolutely. You got another question on veneers. I told you there were 2 hot topics that people would like to ask about. So this one is, what do you recommend? Would you recommend feldspathic veneers? So it's a good thing. It's a good topic to bring up. So when you talk about veneers, we did talk about composites earlier.
Yeah.
But we also have what we call lithium disilicate veneers, which is the most common type of ceramics that dentists are using to do veneers. They were called for a long period of time EMAX. So, and this is the main type.
This is a brand, isn't it?
It's a brand. It's actually a brand from a company, but that company had patents for over 10 years, so they were the only one manufacturing it. But now the patent is over, so we have more companies producing and making these ingots of ceramics called lithium disilicates. And then there is another category of ceramic, which is called feldspathic ceramic. By the way, these porcelain veneers take a lot of time for the lab technician to do. Like it's very demanding. They're made on a refractory die. This is very technical. But feldspathic ceramics will be the best option to opt and go for, especially if you are to have what we call a biomimetic approach.
Mm-hmm.
So where you have to mimic nature. If you want to get, for example, let's say 2 veneers on the 2 front central incisors, then definitely feldspathic is the best way to go, because you're trying to mimic whatever is going next to
of
on
course.
the adjacent teeth, which are natural teeth. Because feldspathic, in terms of translucency, in terms of light absorption, it is just out of this world. So yes, I would use feldspathic, but I wouldn't use it if a patient wanted to have much whiter teeth. Like if the patient
You don't get there.
you don't get there, and it's kind of like, because they're quite more expensive than the others, whereas the lithium disilicates can give you amazing results, and it still works pretty well. So yes, I would recommend feldspathic ceramics in a certain number of scenarios or certain number of clinical conditions that should be assessed by the dental professional. So it's for the dentist to decide which material is more suitable for the case, and accordingly, I mean, sometimes feldspathic and lithium disilicate could be indicated for both, because lithium disilicate do perform very well, even if it's just 2 or 4 veneers.
Yeah.
And then the question is, what are you expecting from the treatment? Are you trying to mimic nature? Is your patient highly demanding, or do you want to get something nicer and whiter? And that's for you and your patient to take the decision together.
Yeah.
Which, by the way, brings me to a topic involving patients in the decision.
Yeah, 100%.
I totally, you would agree, whether it's implants or veneers or whatever it is, your patient should be informed and should be involved and should ask as many questions as possible. And it's our job to answer those questions, don't you think?
Yeah, for sure. At the end, the decision is going to be patients. And at first, our main job is to orient him, kind of explain, well, we have option A, B, C, and here are the disadvantages and advantages of those 3, cost-wise, whatever suits you, and then we go from there. But for sure, it's something that needs to be decided by the patient. So we go to another question here.
That's for you.
As a person with dental anxiety, I would like to know, will I experience any pain during my implant procedure? Like I said before, implant procedures are much less traumatic, for example, than extraction. Most cases. So no, basically the procedure is under local anesthesia. Of course, if we're talking, there is a different approach on this question, but basically, in general, it's not a big invasive procedure. It's something very small that requires, yes, there's a surgical approach on it, which is there is a need of incision, but local anesthesia, it's way more than enough for the procedure to be done. Extremely effective. It's like a half-an-hour procedure. The only thing that I would like to bring is, on cases where the patient presents a severe anxiety on a major level, and he needs to do, let's say, a little bit more invasive procedures, we have options of some sedations or even to do procedures under general anesthesia. Exactly.
Yeah, that's I think one addition to Dr. Michael's dental clinic is most of our specialists are able to see patients under general anesthesia to overcome these kind of situations. Of course, the number one option you give is nitrous oxide sedation, we call conscious sedation, that makes the patient, so it's a mask, and the patient inhales within this mask a gas, which is nitrous oxide, also known as the laughing gas. Right? It relaxes the patient and reduces the anxiety levels. But on a higher level, or if the case is more complex, or if you're doing full mouth rehabs.
Not only that, I had a case recently that the patient was a severe guard reflex.
Oh, yeah.
Impossible to do it. The patient could not tolerate. He said, well, the case was not, let's say, from a dental point of view, was not exactly super complicated, but was reason to extraction way on the back. Difficult to approach. It was impossible in his case. And then, under GA, the patient had the procedure without any problems, fully recovered. It's better for us, better for him. Recovery is perfect. So it is a good asset to have this available whenever needed. Whenever needed.
All right, one more question to go. So, why Dubai became the most important place in the world for dental veneers? It always amazes me. Well, why?
A lot of money in the country, maybe?
I think
it helps.
Yeah, Dubai has always amazed us over the years. Dubai has achieved what no other city in the world, or the UAE in general, has achieved, or what no other country in the world has achieved.
Yeah.
And we have witnessed it, for example, during the COVID pandemic, how the government of Dubai and the UAE were able to overcome the situations and handle the crisis probably better than
most, for sure.
Yeah, better than a lot of countries. So Dubai has always been, very different and unique in its approach. I mean, Veneers are well known in Hollywood as well. They're well known in Brazil, where you come from.
Yeah,
right?
sure.
So Dubai had an approach where
Dubai is a trendy city, so things that are trendy is going to hear. I mean,
needless to mention that we have a pretty much young population here.
Yeah, exactly.
So even though
it's just like the same way you're going to approach how many things. There's no other place that I've seen that has as fancy cars as here.
Yeah.
Because basically it is a place of opportunity. It's nice, so people can afford, and it is, like I said, it's a trendy procedure. People want to look better, so I guess it's normal that this is.
It's also got to do with we got also some of the best dentists in the world based in Dubai, so we're lucky to be practicing in this space and.
People travel abroad to come here to
we got patients coming from all over the world, flying from different parts of the world, Europe, Australia, just to get down.
Middle East, nearby.
Europe, so we got from all different countries. So I think it's just Dubai. That's all.
I never thought about it. If you think about it, I think I had patients from all continents, pretty much.
Yeah,
very common.
We got from Africa, from Middle East, as I said, from the Gulf region. All right, this is for you, Mauricio.
All right, so we have here, I have heard about cases where the mouth rejects the implants. Is that possible? My honest opinion, by the definition of what a rejection actually is, my answer, I would say no. Because rejection, by definition, basically means the following. An example, if you're going to do a heart transplant, which is a living tissue, put another human being, and the surgery goes well, right? The human body is going to identify that heart that you just transplanted as not yours. So your body is going to start, that's why I have to take immunosuppressants, have to take medication, because in theory, your body is going to try to reject it, recognize it's not yours. When you're working with biocompatible materials, this doesn't happen, pretty much. What happens basically is you may fail an implant, which is different, due to all the factors that we mentioned in the previous question, which is bacterial plaque, not cleaning well, gum inflammation, infection. So the fact that you have a bacteria there and that creates an infection on the bone and you end up losing the implant, that is not a rejection. So rejection, basically everything looks fine and then the body expels the implant because so. So I've heard on the literature, myself I never witnessed titanium allergy. Myself I never saw one. But you pretty much, pretty much you can be allergic to anything. So for sure that exists. But myself, I never experienced that. We have cases, let's say, it is a reality in the market to have zirconia implants, which can be used if the patient requests. It's an option. But rejection per se,
for these cases, if they were to happen, which is very rare and uncommon, there are alternatives to titanium implants.
Yeah, exactly.
Which would be the zirconia implants, right?
Yeah.
So that's always a way of overcoming the problem. I'm just gonna check out my Instagram and get one more live question from Instagram. So this question is probably gonna be the last one. We've been online for a while. So do you recommend? Oh, that's for me. Do you recommend bleaching before veneers? I like that question. What do you think? As a matter of fact, yes.
It depends.
I guess, as a matter of fact, yes. Well, it depends. Again, it's a case-by-case scenario, but in all the cases, most patients wanting to get veneers would want to get a whiter smile.
Yeah.
Right? I'm going to try not to be too technical, but when you want to get a whiter smile, I mean, sometimes you can get realistically white, but not too white. And what I usually combine my treatments with is to go do bleaching on the lower teeth, because the lower teeth don't really show much when you talk, whereas the upper is what you're looking at in restoring a smile. So I tell my patient, get some bleaching done on the lowers. If you're happy and satisfied,
use as a guide.
Exactly. If you're happy and satisfied with the outcome of a bleaching. Then we'll do the uppers where we can change the shade, the size, the shape, and everything. We'll do the uppers with veneers.
Got it.
Not only that, if a patient comes with very badly discolored teeth, and we want to get them wider, and we know very well that the ceramic veneer is very thin.
The more wider it needs to go, the deeper is the problem.
Absolutely. So we start off with the bleaching. The only thing we need to bear in mind is there should be a time frame between the bleaching and shaving down the teeth, which is about, let's say, 3 to 4 weeks. This allows time for the teeth to remineralize, to get back its minerals. But then you're good to go, and you can proceed with your restorations. So yes, I do. It's a case-by-case scenario, as my colleague Mauricio said earlier. But again, you know, I would definitely recommend bleaching in, I would say, a big and large number of cases before getting veneers done.
Yeah.
All right, so it was nice.
Okay, yeah.
I enjoyed it.
Nice. Yeah, it was nice.
I thought it was nice.
I
We
guess
should do
that's
this
all right.
more often. All right, guys. So thank you all for joining us today. We hope you enjoyed our live, and we expect to be live again very soon, whether it's Mauricio and I or some other colleagues. So stay tuned. And Mauricio, you want to say the last word before we leave?
Well, basically, as you guys know, we are here in Dr. Michael's, so we're here to see you guys. Besides all the questions, I hope we can kind of enlighten a little bit of all your questions, and come pay us a visit. Just double check whatever you guys needed from veneers from Dr. Amir's side, from implantology, periodontal things that you may require. We're here with our services. Besides, of course, all the stuff, we pretty much cover everything.
Oh, there is much more to Dr. Michael's than just veneers and implants, of course.
Yeah.
We've got more than 5 specialists in orthodontics. We've got pediatric dentists. We've got some amazing and excellent general
root canals,
practitioners,
pretty much everything.
root canal specialists. Yeah, we're a multidisciplinary clinic, and we believe that dentistry is not a one-man show.
No, it's not.
Having said that, thank you for being there, and see you soon.
See you guys.